Deputy Heydon, 30 seconds to put your question.
Here, look, Minister, the voluntary sector plays a key role in our delivery of health and personal social services around the country, as you know, and the origin of many of these was at a time to provide a service when the state did not. The value of their contribution is immense, but with such a different set of arrangements, all formalised at different times in the state's history, it is right that we review and look at all of those relationships that we have with the voluntary sector, the very key role they play, and that we make sure that those relationships are fit for purpose into the future, providing the very best service for all of the range of service users. So it's just to talk about the review that was carried out, Minister. The independent review and the recommendations and the implementation of them.
I want to thank Deputy Heydon for the important question. The report of the independent review group established to examine the role of voluntary organisations in publicly funded health and personal social services was published by me in February of this year. It makes 24 recommendations covering areas such as the governance of voluntary organisations, dialogue, engagement and contractual processes between the state and the voluntary sector, ethos, asset ownership and public capital investment, and broader issues related to health system development. These recommendations are grounded in two key overarching findings. First, the report recognises, as does the Deputy, the important contribution that voluntary organisations make and concluded that they should continue to play an integral role in the delivery of health and social care services. And second, it found a high level of mutual interdependence between the state and voluntary organisations, and it called for the development of a stronger relationship based on trust and partnership. I fully agree with and endorse these findings. Voluntary organisations do have an important role to play in the delivery of our health services, and I have already signalled my commitment to further strengthen the relationship between the state and voluntary organisations. But I also think I have an important role, and the government has an important role, and the Oireachtas has an important role in setting out policy. So it is that relationship that has to mutually respect the responsibilities of each other. As a first step, I have been given approval for the establishment of a new dialogue process between my department, the HSE, and other relevant health agencies, and representation from voluntary organisations in the health and social care sector. This was a recommendation in the report. My department is currently designing this process, including the terms of reference, membership and other practical considerations, and we will engage with voluntary sector representatives in this regard. I believe that this new dialogue process can provide a forum for engaging more effectively with voluntary organisations and key policies and initiatives. I also believe it can provide a forum for taking forward other recommendations in the report, such as those relating to governance. But perhaps more importantly, it can provide the platform for developing greater levels of trust and partnership across the system. This must be a two-way process with recognition of both sides' respective roles and mutual dependencies. There is also a broad range of other recommendations in the report under consideration. The good news is many of these align with the Sláinte Care programme and will be taken forward in this context, and there are some that require collaboration with other government departments, including public expenditure reform, and this work is ongoing.
Time-wise, Minister. Thank you.
Thank you.
Thank you, Minister. Minister, I'm conscious, let's say, in my own constituency, we have remarkable voluntary organisations like CARE, which you'll be aware of yourself from involved in West Wicklow as well as Kildare, and established in 1967 by parents and friends of children with intellectual disabilities. They wanted their children to be able to live at home and go to school locally, and a fantastic organisation that has since seen the development of two great schools in St Anne's on the Curragh and St Mark's in Newbridge, the latter of which I was a member of the Board of Management with for some time. And they're providing their service really, really well. And I'm aware as well of the challenges there are on an ongoing basis. So I think it's really important what you talk about in terms of the future relationship between the department, the HSE and voluntary organisations like CARE, because the department and yourself in your office as policy and us here in the Dáil as policy setters can't abdicate that responsibility. And I recently attended the CARE AGM and was really struck by listening to many of the participants in CARE talk about their desire to live alone instead of group houses in the community, and the fact that that takes multi-annual funding, that takes longer-term planning for them to be able to do that. And that level of engagement, I know it's a key recommendation about multi-annual funding, is a key element of policy into the future.
Yeah, thanks, Deputy Heydon. And I know myself and Minister McGrath very much support you in that regard. And I do know the very good work of CARE in your constituency and in mine, and the very good work of so many voluntary organisations across the country who are an integral part of our health service. And quite frankly, we couldn't do without them. They were providing services long before this state bothered to. And remember, my own department didn't exist till the 1940s. We had a state without a Department of Health because we were reliant on the voluntary sector, and indeed, quite frankly, back then, the church sector as well. But in addition to that, some of our largest hospitals in this country are also voluntary. And I respect the role of voluntary hospitals. Many countries have them, but they need to modernise. They need to be more transparent. They need to be more open. They need to provide a seat at the table for public policymakers, for representatives of the state. And Catherine Day, in her excellent report we're discussing here, made some good recommendations about that, be it a public interest director or whatever we wish to call them. Because you can and must respect the voluntary ethos, and I very much do that, and the good work that's been done. But there's only one forum that sets public sector policy. There's only one forum that sets health policy, and no ethos should prevent people from accessing healthcare. And I think that's the sort of discussion we need to start having with the sector, how we can help them in terms of certainty of funding, how multi-annual funding and the likes, and how they can help us by obviously making sure that we can implement public policy.
Thank you. Final comment to Deputy Heydon.
Yes, you're dead right, and I think at the heart of that then is looking at addressing service level agreements and making sure they're fit for purpose, that they're reviewed and simplified in many ways, that they focus on exactly as close to service provision as possible as they can be. So I come across issues in my constituency all the time, and I've raised with Minister McGrath as well, regarding challenges we face with school leavers at the age of 18 for those with intellectual disabilities and beyond. We have voluntary organisations around the country, and thankfully CARE isn't one of these, but who are in a cycle of constantly having deficits. And there needs to be an in-depth look, and this was recommendation 8.8, is to look and see, is it been adequately funded initially? Is there better ways that they can manage their budgets, or why? But if you're in that cycle of constantly having deficit year on year, you'll never get out of that cycle, and those organisations are then hamstrung from the service we need them to provide. Also, the area recommendation 8.3 regarding official recognition through a charter of the legally separate status of voluntary sector and reflected public service role. But ultimately, Minister, I think it's that due recognition. This Catherine Day report was excellent. It's a huge opportunity for us now to drive on and to show to the voluntary sector that it's a dual relationship where we're interdependent on each other, and to work together so we can better provide a service for people into the future that's fit for purpose.
Yeah, thanks, Deputy Heydon. I agree with you. It is an excellent report, and I want to thank Catherine Day, Jane Grimshaw and Deirdre Madden for doing that body of work. And we heard very much from the voluntary sector in that report that they don't mind complying and providing information, but it's the bureaucracy of it. Can we make it simpler, particularly for smaller organisations, not constantly asking for the same information in multiple different formats? So reducing the bureaucracy, reducing the form filling, whilst making sure that we have the right level of oversight as well. And yes, we will have to address the funding issues, and myself and Minister McGrath are going to have to look at the legacy issues with government colleagues in this regard as well. And obviously, and I know you'd agree with this, alongside any funding, there'll also have to be reform. Things like personalised budgets. I don't believe the provision of disability and social care services, Minister McGrath, into the future is likely to be confined just to block grants, but more about personalised budgets, empowering the person with the disability as well. So I think, like any conversation with any interest group, we'll have to have conversations about appropriate levels of funding and certainty of funding, but also how we reform and modernise the delivery of those services.
Thank you very much, Minister, and thank you, Deputy. Now, Deputy Ann Rabbit, 30 seconds.
To ask the Minister for Health the time frame for the provision of primary